So it is quite a complex role, but probably the first thing to say is that a CCG, a clinical commissioning group, holds the budget for health for a borough. So as a CCG, we have the health budget for St Helens. And the role of the clinical chief executive is to bring strong leadership to the organisation and ensure that we're spending that money in the best possible way, and we're not wasting any of it, and to make sure that the people of St Helens get the right level of care that they need and that we're serving the whole population. The clinical bit is important because the idea is to have somebody in that role who understands patient care, and as a nurse for 20 years I can bring that kind of clinical focus to some of the decisions that we have to make. Okay, so we are very challenged, in particular financial. So we are facing a situation this year when we're going to end up with a deficit at the end of the year, and a big part of my role now is to do everything I can to minimise the amount of that shortfall. So over the next couple of years, we know we've got a lot of financial challenges to make the money go round. Secondly, and linked to this, is activity. So part of the reason for that financial challenge is at the moment there's more demand for the healthcare that we can afford to pay for in St Helens than we've got the money for. And that's a mixture of reasons, but that's things like we have a growing elderly population. Many of people in St Helens have multiple long-term conditions, and also we need to do some work with the public about understanding the demand they put on, so that sometimes people might be using services like A&E when there might be a different alternative. So, and then the last challenge I think that we're facing is restoring confidence. So in the latest ratings we were rated as inadequate earlier this year, and a big challenge for us now is to, as a CCG and as a management team, is to restore confidence, is to get us back on track. And as well as the money, make sure people realise that actually you've got a strong team here who can do the best for St Helens. Well, my ultimate aim, if I'm setting a goal now, is that we're going to be an outstanding organisation by April 2018. So, I'm setting myself that target of we will be more in control of the demand for healthcare, and we will have gone back into a financially strong position, and people will have confidence in St Helens CCG. Well, so part of that already, we've put together a new improvement and financial recovery plan. It's very robust, it's very challenging. The first thing we've done in a very short period of time is really looked at the whole problem, so not just the gap in a savings gap that we have to make, but also we're trying now to really measure and quantify this growing demand, so we understand the pressure that puts on. And we've now identified 10 key areas of action, and there's a mixture of things there. Some of those actions are around doing things a bit better now, and some of it is around transforming healthcare in St Helens over the next 1 to 5 years. So we've got a really clear plan, and what I've done is put senior people in the organisation having leadership and ownership for each of those areas, and my role will be to keep them on track. Well, I'm looking forward to all. I'm actually looking forward to all the people I need to get to know in the whole system. But I'm looking forward to making a difference. I've taken the role on because I live in St Helens, and I've worked in St Helens for a long time, and it's a great place, and there's many brilliant frontline clinical staff, and I want to make sure that we are able to meet the financial challenges so that those people can continue to deliver the best care for people in St Helens.